We had all hoped to be well along the road to transitioning away from mandatory requirements to an approach based on public health advice, personal judgment and personal protective behaviours. This unfortunately is not the case. This vicious and highly contagious disease has once again shown how quickly it can spread. Disease incidence is high and rising. The 14-day incidence is now 668 per 100,000 population, and the 5-day average is 2,588 cases. It's rising across all age groups. We're also seeing increasing numbers in hospital, now at about 515, which is nearly 4% higher than this day last week, and in ICU, where there's currently 90 COVID patients as of this morning. We're in a place where we have to be concerned about the burden and impact that this level of disease is having and could have on our health and social care services in coming weeks and months. We are already seeing the cancellation of procedures and operations across the country, and we have to be concerned that things will deteriorate further. In its most recent advice to me, the National Public Health Emergency Team advised that the epidemiological situation in Ireland indicates a worsening disease profile with the future trajectory very uncertain. It is for this reason that Government, on the advice of NPHET, decided to extend a range of public health protective measures on a mandatory basis. This means we do need to extend these pieces of legislation. As has always been the case throughout the pandemic, the Government continues to commit to use these exceptional powers in a proportionate way. These are emergency powers directly proportionate to our emergency public health environment. Their use is confined to mitigating the impact of the disease on the public's health and are not for prolonging a moment longer than is necessary in our democratic system. They are legitimate and necessary powers that are beneficial to our society in a context where public health protection is paramount with this novel and unpredictable disease. The intention is only to use the provisions within these acts for the measures that are currently in place. For example, the continued requirement for wearing face coverings in certain settings, the use of the COVID pass and other protective measures in the hospitality and event sector. As has always been the case with this disease, we cannot predict with certainty what the trajectory of the disease will be. It is only responsible for us to ensure that we maintain the legislative powers to enable us to continue to respond as necessary and as quickly as possible. The position of NPHET is that the public health management of the COVID-19 pandemic must continue to be agile and responsive and evolve in the light of changing circumstances, risks and emerging evidence, and this will remain the case over the coming months. I would now like to provide a summary of the acts before the House. The Health, Preservation and Protection and Other Emergency Measures in the Public Interest Act 2020 allows the Minister for Health to make regulations giving effect to a range of public health measures for the purposes of protecting the public from COVID-19. The Health Amendment Act 2020 provides for fixed payment notices in respect of certain alleged offences under the aforementioned Act. The third Act, the Criminal Justice Enforcement Powers COVID-19 Act 2020, provides additional enforcement powers to An Garda Síochána to address breaches of the relevant COVID-19 regulations by businesses or services selling or supplying intoxicating liquor for consumption on the premises. I'd like to remind the House and members of the House of each of the sunset provisions in the three acts that are pertinent to today's debate. The original extension of the sunset clauses in each of these acts to the 9th of November was provided in the Health and Criminal Justice COVID-19 Amendment Act 2021. This House approved these extensions when it voted to pass the legislation. Members of the House will remember that I introduced an amendment to the bill, which originally provided for more than one extension of up to 3 months for each act. The amendment I introduced, and that was accepted by the House, permitted only one extension of these acts for a period of up to 3 months on the passing of a resolution providing for such extensions by both houses of the Oireachtas. After this one extension has lapsed, these acts will no longer be operational. The resolution before the House today is to provide for this final extension of the three acts until the 9th of February of next year. We all understand and appreciate the impact on people of this disease and the emergency measures put in place to deal with its harmful effects. I have highlighted before that Ireland is not alone in this crisis. Indeed, all across Europe and much of the rest of the world, COVID-19 has adversely impacted on societies and economies to devastating effect. We are again seeing a changing situation across Europe with rising incidents in many countries. Indeed, the measures we have decided to retain in Ireland are amongst those that other countries are now reaching for. Ireland has endured a profound shock to its social and economic life as we dealt with and deal with the impacts of the disease at an individual level, a community level and a societal level. It's had an impact on almost all aspects of our lives and for many their livelihoods. Our strategy to manage the adverse impacts of COVID has been guided by an evolving understanding of the disease and its emerging variants, the impacts of restrictions on health and well-being, as well as other aspects of society and the economy. The House will know that there have been extraordinary measures introduced to protect public health and the most vulnerable in our society. These were difficult and challenging decisions in a crisis, with an evolving understanding of the disease, its impact, how best to manage it, what vaccines might offer and what variants might do to undermine our plans. Members of the House will know that by passing these instruments, we are prolonging on a temporary basis only the emergency health platform from which we can deal with and manage the disease. Any requirements to extend these provisions beyond the 9th of February will require new legislation. These are not easy decisions for all of us in this House to make. They do not sit easily with us and they do not sit easily with government. And it is the stated hope of government, and I have no doubt all members of this House, that we won't have to be in a position to use the provisions in these acts any further than is currently the case. But I must again reiterate the caveat that we simply cannot know what is going to face us over the coming months. The reason we are able to keep so much open in light of such high case numbers is, of course, our vaccination programme, which continues to be a great success. Indeed, it's the envy of much of the world, with 93% of people eligible for a vaccination having come forward to protect themselves and to protect each other. We continue to see more and more people come forward, with over 24,000 new registrations recently. Our booster programme for the most vulnerable is well underway. Those who are immunocompromised are receiving a third dose. Residents of long-term residential care aged 65 and above are receiving their booster, as are those aged 80 and above in the community. This week, we're beginning with booster doses for those aged 60 to 79. And last night, I authorised booster vaccines for our healthcare workers, and these will get underway either this weekend or early next week. In conclusion, Ceann Comhairle, the continuance and operation of these emergency powers maintains the potential and the flexibility to respond to an emerging COVID threat that could jeopardise public health and safety to unacceptable levels were it to go unchecked. The government must act with caution to ensure the most vulnerable continue to be protected to the best of our ability. I commend the motion to the House.
Thank you very much, Minister Deputy Cullinane.
Margaret, and sharing time, I think Seachta was nodding if he comes in, so I have 10 minutes, I think. First of all, Minister, it's not the first time we've been here where we have come back to see an extension of the emergency powers, and from the outset I'll say that I will be opposing this motion, as I have done previous motions which you have brought forward. And I say that, Minister, and I hope that you accept this. I say that not because I oppose continuing levels of public health measures. In fact, I do, and I support the wearing of face masks, testing requirements, travel restrictions, the passenger locator forms and other measures which are deemed essential to combating the spread of COVID-19. And I accept that some restrictions will need to be maintained and some public health measures will obviously have to remain in place so long as they are necessary. But I think it's also reasonable to say that circumstances have changed since this legislation was first introduced in the first wave of early 2000. We're in a different place now, Minister. You acknowledge that yourself. And I'm opposed in principle to continuing emergency powers nearly 2 years into a pandemic. I remember the very first debate, Minister, and subsequent debates where you made it very clear these were powers you did not want. These were powers which are and were rightly seen as draconian and only should be in place for as long as they are necessary. And I think the time has come where they are no longer necessary. And what I would have preferred, Minister, is that if you had brought forward appropriate primary legislation today which does not needlessly and unaccountably devolve the powers of the Oireachtas to you as Minister for Health. It is the Oireachtas which makes the law, not the government or departments, and I believe that we have a constitutional duty to protect the separation of those institutions. And I say that, Minister, because time and again regulations have been crafted by you as Minister for Health. Sometimes the regulations have been good, sometimes not so good, and very often there has been a lot of problems with those regulations. We saw the fiasco of the most recent regulations in relation to the reopening of nightclubs. And again, we had meeting after meeting. Every time we thought there was agreement, there was more talks, and we actually had a bizarre situation where for almost a week there was no regulations as the discussions were ongoing. No debate in this House, no democratic accountability, no insight, no oversight, and no discussion with the opposition to any satisfactory degree. And I think that, Minister, is unacceptable. So I think that we need to stop doing that. I think if there's regulations that are substantial, they should come before this House for proper debate, and I'll support the amendment which has been tabled by Deputy Shorthall, which calls for exactly that. I proposed a bill with my colleague Dr. Dáil on this very issue, Minister, which wasn't opposed by our government at first stage, where we essentially called for all of those regulations that are a product of the emergency powers that were given to you to come before this House no later than 2 weeks after they were crafted, to be properly discussed and debated, and of course that hasn't happened. This will be the third extension, Minister, of Part 3 of the Preservation and Protection of Other Emergency Measures in the Public Interest Act 2020. It's also the 10th time that the Government have either introduced more emergency powers for the Minister for Health or sought to extend existing emergency powers already in place. And that's not counting the initial acts which we all supported in early 2020. Every time, Minister, we call for more oversight, more engagement and more scrutiny, and every time that's ignored. And we end up then with all of the messing that sometimes goes on, the mixed messages, different things being said by different ministers, various interpretations of guidelines versus regulations and so on, and it all comes back to a clumsy approach by government and a lack of any real engagement with the opposition and indeed I would say with the public. So I think you devalue this House, Minister, when you continue with the route that you were on. I think you devalue the role of the Oireachtas in crafting legislation and actually having a proper debate, so that where there are deficiencies, where there are a lack of certainty exists, this House can play, as it does, a very important role in scrutiny, in oversight and debate. And we have been deprived that because of these emergency powers, which we agreed to give to the government in the very early stages of the pandemic for justifiable reasons, because we were in an emergency. And everybody accepted that once the emergency was over, then those powers should be scrapped. And yet you're coming here again, Minister, in a completely different set of circumstances, looking for this bill and looking for all of these bills to be extended by a further 3 months. I don't believe, Minister, that is acceptable, and I don't believe that it's the way that these type of issues should be dealt with. I want to raise a couple of issues, Minister, that you raised yourself in relation to the booster jab. So can I first of all welcome the fact that the booster jab will now be given to those on the front line in healthcare. I've been calling for this for some time. I think it was the right move. I know NIAC made a recommendation and you've authorised that use. That needs to happen very, very quickly. And we know how difficult it is for those on the front line in healthcare at the moment. Many of them have had COVID, sometimes multiple times. Many of them are out of work, and they are on the front line, the coal face of dealing with this virus. And I think it was the right thing to do, as belated as it was. I also raised with you privately a number of weeks ago, Minister, a difficulty that some blood cancer patients are having in getting their booster jab. And the problem is that they don't know who is going to roll it out. Many of them would have got their booster jab, for example, from the Beacon Hospital. They contact the Beacon Hospital and are told, go to your GP. They go to their GP and are told, go back to the Beacon Hospital, and they don't know what to do. And they're simply looking for clarity. Do they have to take any action themselves, or is it something that they will be contacted on? I think that's a reasonable question that they want answered, because they're simply looking for clarity. I also believe that we need to be planning now for the rollout of the booster jab for the entire population at some point. Obviously, NIAC will make a recommendation as to when the appropriate time for that is, and I do understand that we have to make sure that we also play our part in making sure that the rest of the world and developing countries also have access to the vaccines. But it's prudent that we start planning now for the rollout of the booster jab, I think, for the entire population. And for the remainder of the couple of minutes I have, Minister, and we will deal more substantially with some of the wider health issues this evening in a private member's motion that I am tabling, if you are here for that motion, which I hope you are. But I have to say to you, Minister, that what's happening in our hospitals at the moment is absolutely shocking. And when you talk to people on the front line, they are beyond exhausted. I have never seen anything like it. When you're looking at what's happening in hospitals like Limerick and Sligo and Kerry and Galway and in other parts of the country as well, where overcrowding is at record levels for this time of the year. That the sheer volume of unscheduled care which is hitting those acute hospitals is forcing them again to have to cancel unscheduled care, and not just electives, but we're seeing some hospitals have to cancel time-sensitive care as well. That had to happen time and again during this pandemic, and we all know the consequences of that, with a huge amount of built-up miscare that has to be caught up on. That's in part why we're seeing a lot of presentations now to emergency departments. We're seeing people present in greater number, but they're also sicker in presenting, because a lot of them are people who maybe didn't get the level of care that they should have got because of all of the measures that had to be put in place in hospitals during COVID. So it's a really, really difficult time period. We've over 500 people a day on average now in hospital trolleys. And those on the front line are wondering what's going to happen for the rest of November as it progresses for December and January. Many of them talk to me about moral injury, that they can't take a break, they can't take annual leave, because the pressures they're being put under by hospital management to stay for as long as they can, because of the sheer volume of work and the sheer volume of patients which need to be treated. That simply isn't sustainable. It is not sustainable. And I said this to you as far back as the summer, as far back as June. I was saying that we needed to prepare for the winter and what was coming at us, because we could potentially have a change in the pattern of COVID, we could have the flu with us, and we also have, as I see it now, more people presenting with respiratory illnesses and other illnesses into our emergency departments. We have real problems with GP access, out of hours GP access. Many people can't go in and can't get access to a GP in their surgery, which is also forcing more people into emergency departments, which probably shouldn't be there. And it's a perfect storm. And it's hit the health service, and the people who are the victims are patients on the one hand, left on trolleys, are now having their care cancelled, or those on the front line who've had enough. And I really have to say that to you, Minister, today, that something has to happen, and a real plan has to be put in place. I don't have any faith in your waiting list plan. Forget about it. What I've seen from your waiting list plan is not going to work. Wait times are going to go up because electives are being cancelled and procedures are being cancelled. So you really need to fundamentally look at doing something profound and something urgent to address the real crisis that we have in our hospitals. Thank you.